I'm Ann Jesse, and I'm the immediate past president for Aaacn. And we really appreciate you joining or listening today to our Ask the Candidates town hall. So we will begin by asking the candidates to present a little bit about themselves, and then I will be asking each candidate a question. Please feel free to enter in any additional questions that you want to ask the candidates in the chat, and then we'll make sure we cover those before the end of our time together today. The candidates for Board of Directors. So Mary Blankson, would you like to introduce yourself?
Wonderful. Thank you so much, Anne. My name is Mary Blankson. I'm a family nurse practitioner by training. And in my current clinical role, I'm the Chief Nursing Officer of Community Health Center, Inc., which is the largest federally qualified health center here in the state of Connecticut, where I'm calling from today. So I really love that Aaacn has given us this opportunity to be able to share with our members why did we even decide to run for this office of Board of Directors. And I think for many of us reflecting on our own personal journeys, I've been a nurse leader for the last 7 years, but I actually began working in Aaacn and really benefiting from a lot of the support that they give right when I began my journey as a nurse leader. Just having access to tools and other thoughts to be able to really support me as I grew as a leader was so very important. And I feel like a lot of that mentoring and a lot of the support that I've received along the way, along with connections and opportunities, has been really beneficial. My expertise is mainly in primary care nursing. You'll probably, right around the time that I began my journey as a chief nursing officer, as well as joined Aaacn, I also had the privilege of co-authoring one of the papers with Dr. Margaret Flinter for the 2016 Josiah Macy Foundation meeting focused on the role of the primary care nurse. Certainly, ambulatory care nursing includes more than just primary care, but I really look forward to the potential opportunity to bring my primary care expertise to the larger group and to be able to better connect maybe some sectors like federally qualified health centers and others as we work to build more tools and supports for our leaders and for our members as we grow in our roles here in ambulatory care.
Thank you, Mary. I'm going to start us off with a question. If you were elected to the Board of Directors, what would be the priority in terms of the goals that you would like to advance for Aaacn?
I think one of the goals that I'm really most interested in forwarding is just this consistent discussion around equity. I think we all know the nursing workforce. We have really struggled in some ways to increase the amount of diversity and to really improve our ability to raise up leaders that don't all just like me. And really having worked in a federally qualified health center for the last 16 years, and especially now as a nurse leader, leading a very diverse group of medical assistants and a very diverse group of nurses as well, I really need to have more tools and supports to figure out, how do I support these leaders? How do I mentor them? How do I bring them into the fold here in national organizations like Aaacn, where they can be mentored and supported to success, so that they can really gain more visibility? Equity in so many ways, not just in our members, but in our workforce, in our education and educators, as well as, looking at, how do we create the tools and supports that our teams need, taking care of a very diverse patient population as well. So that is definitely something that I'm really passionate about. And that certainly was very clear in Aaacn's strategic plan as a theme throughout all of the areas that Aaacn aims to focus on. But that is one that I'm particularly interested in.
Thank you, Mary. For now, we don't have any questions in the chat, so we'll move on and maybe we'll have some more questions towards the end of our time together. So next up is Cynthia Murray. Cynthia, would you tell us a little bit about yourself?
Hi, Ann. I got to put my video back on. Says it won't let me start it. Somebody had turned it off.
Nick, can you help us with that? And maybe in the meantime, Cynthia, if you want to go ahead and introduce yourself.
Sure. So my name is Cynthia Murray.
There you
Hello,
are.
everybody. How are you? So my name is Cynthia Murray. I've been a member of Aaacn since about 2008 and currently serve our nation at the United States Veterans Health Administration, VA Central Office, Washington, D.C., within the Office of Nursing Services as the clinical nurse educator, clinical nurse advisor, not educator, subject matter expert for primary care nursing. I also serve my veteran population here in Southern New Jersey. My first experience in ambulatory care occurred when I was about 8 years old, when I accompanied my great uncle Viv Edwards, on his rounds in the back mountains of Pennsylvania as a country doctor, ministering to those who could ill afford or have access to any type of health care other than his visits to them. He charged by chickens and, and lasting friendships. I told him at that time I was going to be a doctor when I grew up, and he said, no, you will not. You are going to be a nurse. You can do most things that a doctor can do, but as a nurse, you'll be taught to see the patient and not the disease. So in about 1991, my very young husband at that time sold our first home so that I could pursue that dream of dear Uncle Viv. And off to LPN training I went. In about 1992, I was able to complete that training. And by 1995, my small community hospital helped me to achieve my RN. I went on to work in acute care, critical care, long-term visiting nurse. And in about the year 2000, I landed my federal position with the Department of Justice as a flight nurse. Around 9/11, I thought as I was flying on a Learjet with a 9mm and a defibrillator, I needed to take care of another type of population of patients. And by 2003, I was blessed with the opportunity to serve in the United States Veterans Health Administration. In that ambulatory care practice setting, which was an evolving, growing setting, I found that I needed to find some standards of care within this area. A wonderful mentor, Dr. Alicia Mobley, she had suggested to me that I needed to look for the organization that was the founding experts for board certification in this practice setting. Well, lo and behold, I found Aaacn. Well, I began to gobble everything possible between the standards of care and core curriculums in order for me to be able to provide excellent care in which I was practicing. By 2008, I had attained my board certification, received my bachelor's at the University of Dundee in Scotland in nursing research, and joined Aaacn as a member, because I had thought that you had to have all this criteria before you could become a member. Well, that one step opened the floodgate of information, mentoring, and experts that I couldn't have paid $1 million to receive. I joined every SIG that was possible, listened to every Q&A on every listserv, and began to develop a practice that really has affected this nation. In 2014 or so, there was a call out for volunteering for the CCTM Scopes and Standards inaugural edition. And I just put my hand up to volunteer, and lo and behold, I was asked to chair. So a dream of pursuing an education at another university took the back step of the University of Aaacn, in which since about 2014 to present, I have been honored to serve on multiple scopes and standards of professional practice, core curriculums, the role of the RN, NSI industry report. I've been able to represent Aaacn at the National League of Nurses, spoke at our conferences, our SIG sessions, and most recently, I was able to represent Aaacn with Rittenhouse on a board speaking about telehealth and the products that were available. It just so happened that Aaacn had such a mind for the future, always has, and has wonderful individuals. The 2019 revision of telehealth came right in time for a global pandemic. And I was grateful to have been part of that process. I have much more that I could say, but there's some wonderful people who are on this panel who I am in awe that I get to sit here. So thank you very much for everyone who's here. And thank you for your attention and membership to Aaacn.
Thank you, Cynthia. in order to keep us on time, I'm going to be giving each candidate a couple of minutes to answer the questions. So my question for you is, what specific strength or strengths would you bring to the board of directors in relationship to the role description?
I believe my strengths are coalition building, and also project management. I've been tasked for multiple projects throughout my membership with AAACN. And speaking of that CCTM, that very first scopes and standards, I was given 6 months to have it completed, if you can imagine. And guess what? We had it done. And coalition building, I believe I have that ability. Like I spoke about, I looked for the standards of care as a nurse in 2003. I couldn't get my organization to understand the value of ambulatory at that time. So I got my own scopes and standards, but I thought, you know what, I need to be participating in this process and help to develop those scopes and standards into the future. And within the Veterans Health Administration, enterprise-wide, every nurse within the organization now has access to those types of scopes and standards of practice. Building coalitions is kind of where I live.
That's great. Thank you. And so far, no questions in the chat. So we'll move on to Chris Ryrock. Chris?
All right. So I think I'm off mute, but I can't start the video. I think that's going to be done by Danielle. Is that correct?
Yeah, I think Nikki will get you off.
Oh, wonderful.
If you want to go ahead,
I'll just go ahead and get started. I want to thank everybody on the call today for giving me the opportunity to introduce myself. My name is Christine Rygrock. I live in Los Angeles area, very close to Pasadena, and I have. It's really an honor to be able to be here with you today. So I want to cover first a little bit about my background, some of my AAACN experience, and then why I'm interested in the board of directors. So in terms of my background, I started out as an adult critical care nurse and quickly realized that the hospital space, while interesting, fun, and exciting, that I really could see that the action was really all happening over in the ambulatory care center. And so I transitioned over and began doing cardiac rehab. I've managed a training clinic at Cedars-Sinai Hospital in Los Angeles. At Kaiser Permanente, I've managed ambulatory clinics for OBGYN, urgent care, ophthalmology, and urology. So I have a lot of varied experience in the operations of an ambulatory clinic. And then I moved to the regional offices for Kaiser Permanente in Southern Cal and worked with the physician groups and ended up in the quality department and been in quality for many years. And it's really a fascinating place to be, particularly as the pandemic hit and with all the testing issues and operational issues that confronted every organization across the United States. So I have a very varied background. I was fortunate to be able to retire in July. And since that time, I've been actually doing a little bit of consulting with Kaiser Permanente. So I've remained active in my clinical practice and exposure. In terms of my experience with AAACN, I've been a member for many, many years and have been fortunate to be able to have done poster presentations as well as podium presentations on a wide variety of topics, from project management to how to build a strong culture within a team. So that's been a great experience that I've been appreciative of. I also chaired the SIG leadership SIG for several years, and I have taught the ambulatory certification training course with Murray and Susan Paschke as well. In the last 3 years, have been serving on the board of directors, and it's been just a wonderful experience. I'm sorry, my kitties just decided to say hello. It's been a wonderful experience. So I've had kind of a deep appreciation for the varied experiences that AAACN can bring you. both in my experience as a leader in my clinical life and in my AAACN life, I think the things that have been important to me is mentoring the next generation that are coming up behind us, and how do we ensure that the healthcare system and the leaders and frontline staff stay strong. And that has really been a passion personally of mine, and the building of strong cultures that promote both the well-being of the nurse and of the patient and the organization. So in terms of why I'm interested of running for the board again is the mission of our organization is to promote the art and science of the ambulatory care nurse. And from my perspective, I think we really do that in two significant ways. One, on a national level, just ensuring that our voice is heard at the table of large healthcare decision making, and that AAACN is absolutely recognized as the expert for ambulatory care nursing. And then I also think on a personal level, the AAACN really promotes leaders and frontline nurses through education, opportunities to present, resources, networking, and the ability to step up, assume leadership within the organization, and provide their expertise. So I think that our organization lives up to our mission, and it's a mission that is definitely aligned with my passion for mentoring the next generation. And that's why I'm interested in running for the board again. And I would very much like to ask for your vote, and thank you so much.
So for you, Chris, and for the rest of the candidates, Jenny will send you an appointment or send you a message to accept the video, and that will bring your video up. So Chris, I don't know if you can see that now, and maybe you can bring your video up before I ask you the question. Or Jenny can resend it.
No, start my video. There we go. Let me try again.
Because we got to see your smiling face.
There you go. I know it's not very interesting to listen to a blank cell. And I think we've all done a little too much of that in the last year and a half. So
that's right.
Thanks for fixing that.
Absolutely. And so I have a question for you.
Sure.
What do you see as the biggest AAACN membership benefit, and how would you like to see it expanded?
I think one of the biggest benefits for me personally is the ability to, I'm going to kind of cheat and give two. One, I think opportunities to network with other nurses across the nation, and the ability to obtain high quality resources on our website. In a sense, the two almost go hand in hand, because in the SIGs, you can put out a question and you can get answers back, and then there are tools to support you. So I think that ability to network with people and with tools is really one of the biggest assets that we bring to the nurse, both the leader and the front line. So I think that's, to me, the biggest benefit. And then just the friendships you get with the networking as well is really of value. In terms of expanding that, I think that we're increasingly working on, there's task forces and tools continually being refined and developed. There's materials coming out shortly on academic and practice, and how do we integrate new nurses, and how do we integrate those together. And I think really the tools to develop, how do we integrate new nurses into the ambulatory setting, because there's such a competition for new nurses, both in the hospital setting and the ambulatory setting. We need to be able to understand how to integrate them in, and how to make them understand how exciting the ambulatory space really is. So I think that the tools that are coming out will really support that integration of new nurses into the ambulatory setting.
Thank you, Chris.
Sure.
We don't have any questions in the chat yet, so move on to Stephanie Whitwer. Stephanie.
And I guess I'm going to go off video.
Okay, getting organized here. Pardon me. I am so honored to be a candidate for the AAACN Board of Directors. I've been very active in professional organizations for all of my professional career, and we all strive to improve our communities and workplaces, but as a profession, we are really called to a higher responsibility. And for members of AAACN, that higher responsibility is really to lift up ambulatory care nursing by promoting excellence in innovation in nursing practice, educating the public about what we do, advocating for public policy that puts people and healthcare first, and creating the evidence that informs the ambulatory care nursing practice of the future. As the unifying voice for ambulatory care nursing, AAACN does all of this. A little bit about me personally. I grew up in North Dakota and worked there as a staff nurse in acute care. A public health nurse, became a chief nursing officer in a community hospital, and was a faculty member in a BSN program. 15 years ago, I took a big leap, moving to Rochester, Minnesota to take a newly created job as a primary care nurse administrator at the Mayo Clinic. Over my 15 years here in primary care and supporting other ambulatory practices as well, I have had the privilege to work with some incredibly gifted nurses who are so passionate about primary care and our community. And together, I feel like we've made huge strides in advancing and expanding the nursing role, with, of course, many, many more ideas and directions that we still need to go. From a AAACN perspective, I've had a very active 9 years. I presented at conferences and exhibited posters. And for some of you who know me, you know that I do like to write, and I have been active in several projects that I'm very proud of, including was co-editor of the 2017 Role of the Ambulatory Care Nurse Position Statement. I am currently a member of the Viewpoint Editorial Board and column editor for the CCTM column. I was co-author of the Support for Self-Management chapter in the initial CCTM core curriculum book, and became co-editor of the 4th edition of the Ambulatory Nursing Core Curriculum and editor of the 5th edition of the Ambulatory Care Nursing Certification Review Questions. Most recently, I was one of the team leaders for the Academic Practice Partnerships Guidelines Task Force, which recently completed its work. Since then, I have joined the legislative team. I have loved every minute of my work with AAACN, but probably my most proud moments were receiving the President's Above and Beyond Award and the Administrative Excellence Award, which was made even more special as I was nominated by my colleagues for this award. As you can see, the work that AAACN does to advance the role of the ambulatory care nurse has really ignited a passion in me. Like many of us, I've been part of my organization's response to COVID-19 pandemic. And while this pandemic has been tragic in so many ways, it has also had some positive impacts. It has disrupted some of our old ideas and traditional ways of thinking about healthcare, propelling us forward to a future more open to new ways to provide safe and high quality care. And with disruption comes opportunity. Several organizations are seizing this opportunity to advance an agenda for national healthcare reform. Although nursing's response to COVID-19 pandemic was well recognized, ambulatory care nursing still has much work to be done to be perceived as a significant answer to future healthcare challenges. So now is the perfect opportunity for AAACN to join the national discussion about the future of healthcare and aggressively seek ways to raise the profile of ambulatory care nursing as one of the solutions to high quality, safe, efficient, and cost-effective care. I would love to support AAACN in this work. I hope you will consider voting for me for the AAACN Board of Directors. I look forward to representing you. As a member of the Board of Directors, I will work to embrace new thinking about the role of the ambulatory care nurse, advocate for policy change to support equitable reimbursement for nursing care, and continue to seek ways to ensure a financially strong organization for the future. Thank you.
Thank you, Stephanie. My question for you is, what component of the strategic plan resonates the most with you and why?
So I think, boy, that's a hard question, Anne. I've always been a strong advocate for advancing the role of the ambulatory care nurse, and have had so many opportunities through AAACN to be part of some of the seminal documents that have done that advancement. So I think for me, continuing to create that evidence base for the nursing practice of the future, I do have a little bit of an interest in the research side and quality improvement side of things, but really getting out there in the arena to raise the profile of the ambulatory care nurse and to help us be seen more as a solution to some of the healthcare challenges of the future, I think would be a great opportunity and an area of strength for myself. Thank you.
That was great. Thanks. Still no questions in the chat. So we will move on to the nominating committee applicants nominees. Carolyn Coburn, would you like to go first?
Yes, thank you. Of course, it is tricky to say, would you like to go first?
I didn't give you a choice, did I?
No, but that's fine. I'm happy to go first with such a wonderful group of people to be in this mix. I'm Caroline Coburn. I am an associate clinical professor at Emory University in Atlanta, Georgia. My background is both acute and ambulatory care. Acute for many years, and then in recent years have worked in a heart failure clinic at the VA in Atlanta, Georgia, and at a volunteering at a local clinic that serves primarily refugees and immigrants. And in AAACN, I've been a member for several years. I can't remember exactly the first year I came. Dina Gilland was the one who sold me on AAACN, and what a wonderful organization that was, and she's right. I've met members through presenting at conferences. There are other schools. Emory has a HRSA grant for primary care, and other schools have gotten the same grant, and we've had a chance to talk together about that. Some of the members actually here on this call were contributors to the textbook that Dina and Beth Ann Swan and I edited for ambulatory care nursing, perspectives in ambulatory care nursing, to give it a little plug. And most recently, I'm also was one of the team leads for the Academic Practice Guidelines Task Force, which all of these have just been a wonderful opportunity to meet the incredible amount of talent and expertise in AAACN, which would be also a benefit as a member of the nominating committee, which leads me to the kind of why should you vote for me part of this. And I do think that since the whole point of this committee is to find and to nurture future leaders for AAACN, I think the academic part of my background fits well with the practice partners to both to search for and to evaluate candidates for any jobs available, any positions available at AAACN. And I very strongly believe that AAACN has a commitment to include the widest possible group of people to contribute to the ongoing mission. Includes people with different ages, races, ethnic backgrounds, any other kind of distinctions that could be made for people. One of the things everyone has heard often is the most dangerous situation is someone who doesn't know what they don't know. And that applies to me. And I think it applies to most people, actually. But the important thing is I realize that I fall in that category. There are many things that I don't know and didn't realize I didn't know until recent times. I'm clueless about many things, but I'm also open to finding out about the things that I don't realize I didn't know. And the way that you find these things out is from having a lot of different points of view to the conversation, and for everyone to be willing to listen, which to me is the absolutely most important part. So that to me is part of the reason that I think that is part of the attitude that I think I can bring to this committee, to want to include as many people and as many voices as we possibly can. I sing in a community chorus, and I want to just talk for a second, if you will indulge me on it. We're doing a recently composed piece. It was composed in 2020, I think. It's called the name of it is Call Across. And the composer said that he speaks to the need for unity, compassion, and understanding. Those are his quotes that are needed right now in this world. And I think it also speaks to the vision of finding leaders for an organization. That is what we need for this kind of a setting. One of the repeated lines in that piece is, "There is no beauty without your voice." And he goes on to say, "I call across canyons, I call across plains, I call across colors, I call across time." And the last line in the piece says, "What beauty can we make if our voices join?" Which it just really resonates with me. So I would look very much forward to finding many different voices to join AAACN and advance the mission and vision of this organization. Thank you.
Carolyn, you gave me the perfect segue for my question.
If it's about music, oh, good.
No, you can use the analogy. So what strategies and interventions would you deploy to encourage folks to participate in the nominating process, to really get candidates to go through the pipeline?
I think the key really is to involving as many. I'm sorry, I can't remember who talked about collaboration, but I think that's the key, to find as many people as possible to collaborate. And because whether you like it or not, I mean, obviously I am an older white woman. How much older, I'm not going to say, but what I say when I come to speak to try to reach to people, it may not resonate as much as if I bring in someone who also has the same background and the same kind of past history that someone might have, and they can say, well, yes, this person can really talk about how I can contribute myself. I may have some of that information, but I think it's important to have people who can share a similar background. So to me, that would be, it would mean, if you're talking about tactics, it would mean reaching out to the people I know across the country, all of the different people with different backgrounds and different orientations, and saying, okay, what kind of candidates, what kind of names can you give us? Or what kind of ideas do you have for ways we could reach out and find good candidates for this position?
Thank you. Thank you very much. Lisa Duncan.
Hi, here I am. Hello, my name is Lisa Duncan. I work for a community clinic organization called Family Health Centers of San Diego here in sunny San Diego, California. And I worked for the company for over 20 years. One of the first things, and I came in as director of nursing, and it was a lonely position and I didn't have a lot of resources. And while I knew something about working in ambulatory care, because I had done so before, I'd not been a director of nursing for a community clinic organization before. And I knew right away that I was going to need lots of help, lots of assistance, lots of references, lots of resources. And I started looking online for those, and I stumbled upon AAACN, and it was just the probably best day for me, because AAACN, and I joined very quickly after discovering it. So not long into my career here at Family Health Centers. And I just loved using the resources, listening, reading the discussion boards, posting questions to the discussion board and getting answers back, chatting offline with some people further to get their experience and to know more about what they were doing. And it's just been, my membership has benefited me a lot. I also became part of the ambulatory care nurse executive toolkit development team. And that was a huge, exciting project. And I got to talk to nurses from lots of different types of organizations, big hospital-based systems, big university-based systems. And then Mary, who is also from an FQHC, worked on it. And so it was good to see what does nursing, ambulatory care nursing look like in all different types of settings. One of the reasons why I want to be part of the nominating committee is because I realized that as I deepened my relationship, and it sounds kind of weird when I put it that way, but as I got closer and deepened my relationship with AAACN and got more involved, then the more I benefited from my membership, and I benefited more from that involvement. And I would like to bring that opportunity to more people, to get them to know what it's like to be a really big part of an organization, part of a big project, and how much you can grow and learn as being part of that. So that's why I want to be part of the nominating committee. And if you don't vote for me, please vote.
Love that. So as you know, and as everybody on this call probably knows, annually we give out awards and scholarships. And it's part of the work of the nominating committee to manage that process and help come up with ways to communicate. It's time to, promote somebody. Here's the process. We blast it out on social media. But we do struggle with getting applicants for those awards and for those scholarships. So could you maybe describe how you might approach that as a member of the nominating committee to maybe optimize that process and to see if we could get more applicants?
Sure. Probably arm twisting isn't a very good idea. We don't want to physically assault anyone, but really reaching out and doing that personal touch, looking at who else is participating in discussion boards, look at who's presenting at the conference, see who is maybe interested in becoming involved in a more deep way and may have contributed something, and then directly contacting them and say, hey, do you have any ideas for us? Or are you someone who should be nominated? Are you someone who would like to step up and serve? Do you know anybody who you work with who goes to school who might need a scholarship that could really help? So I think that personal touch and reaching out to people is really critical.
Thank you. I appreciate that, Lisa. And we still don't have any questions in the chat, so I will move on to April Howell. April.
Hello, how are you?
Hi.
Hi, just trying to start the video. There we go. Hi, my name's April Howell. I'm the director for ambulatory at the University of Virginia for the Heart and Vascular Center. I've been a nurse since 1984 and have been primarily involved in ambulatory care nursing, both in a community setting as well as in a large academic medical center. Throughout my career, I have been involved in AAACN, primarily as a member and involved on various discussion boards. I've been able to utilize the wonderful resources available, and primarily focusing on things like the triage nursing role, which I think is one of the biggest areas that AAACN has influenced my career. One of the goals is to strengthen our core. At the core of our organization is our members and its leaders. And so that's one of the reasons why I considered even running for a nominating committee. As you can tell, I'm a little nervous after listening to all the others that have been nominated for the various candidates for these roles. I feel like I'm probably about this big in comparison, but I just love the opportunity to even be considered. So why am I interested in the nominating committee? Because I feel like it's an opportunity for me to give back. This organization has given a lot to me, to our organization, has helped shape my career. So I feel like this is an opportunity for me to reach out, find others that may be interested in helping to continuously shape the organization and be able to strengthen that core. One of the mission statement is the art and science of nursing, and that really speaks to me, primarily because I feel like nursing truly is an art. The science portion, data-driven, evidence-based, is what I kind of focus on throughout my career. Ambulatory nursing is fast-growing. It is the core of the care continuum, and I think one of the things on the strategic plan is the ambulatory care nurse as an individual, as well as the focus of the team. And I see that shifting and changing here more recently, going back to that team-based model. So what does that mean for our organization? What does that mean for our members? I feel a couple people mentioned diversity in nursing. And so one of the roles on the nominating committee is to find diversity in our leaders, as well as people who just want to, make that difference. So thank you for even considering me for this position.
Well, thank you, April. You bring a lot to the table, as does everyone else. So could you talk a little bit about what specific strength you would bring to the board of directors, nominating committee, in relation to your role description, to the role description of the nominating committee?
I think the strength is in those relationships and building those connections. It's finding, I think the person just who spoke right before me says finding those connections, finding that collaboration. And that's where I think I have that strength in my career, is finding those people who want to make a difference and pushing something a little bit forward, one piece or one section at a time. It's part of the journey. So I think that's primarily the strength that I would bring, is in the relationships, pulling out information from other people, finding their strengths and where their passions are, and how do you build off of that.
Thank you, April. Really appreciate it.
Mm-hmm. Thank you.
So next up, we have Aaacn.
Good afternoon. So I'm Aaacn. I'm the System Chief Nurse Officer for Sutter Health, which is a large integrated health system in Northern California. Our corporate office is in Sacramento, and we serve about 3.5 million people. As the system CNO, I'm responsible for nursing practice across the enterprise, which for us includes 5 very large medical foundations where we treat thousands of people every day for conditions and chronic and preventive of all age groups. As the system CNO, one of the first things I did when I arrived at Sutter 6 years ago was look at the ambulatory operations, how we provided care, and more importantly, what structure we had there for nursing. The advanced practice nurses became my first best friends in that area, and I created an advanced practice clinicians council with the assistance of one of my directors of professional practice, who herself is a family nurse practitioner. I think that was probably one of the best things I did when I arrived at Sutter, given that care is quickly moving to the ambulatory world. And if ever it got a push and a shove, it got one in the last 18 months. And I'm happy to say that I think we had a wonderful foundation and ambulatory nursing practice group that could take on all of the new things we learned about the pandemic. I look back on that APC council today. They give governance to themselves. They look at opportunities for recruitment and hiring of new APCs, both nurse practitioners and physician's assistants. And they've created a mentorship program to safely onboard new graduates of APC programs. And I look forward to continuing to support that group into the next area that they'd like to tackle and solve as advanced practice clinicians. Within nursing leadership, I started my career at West Virginia University in Morgantown, West Virginia. Go Mountaineers. I was lucky to be a new grad of that School of Nursing and to work at that academic medical center, where I spent a short amount of time in the ambulatory nursing practice. I worked in an orthopedic total joint replacement clinic, and I loved it. I loved that field of nursing. I loved the pre-surgical event with the patients, caring for them, getting them ready for surgery, and then being with them post-surgery, and then the really great part, following them in the clinic to see their recovery. I spent a few other short stints in ambulatory and neurology department, and a very short stint in a fertility clinic. But I enjoyed ambulatory nursing. But I got pulled away to nursing leadership quickly, and that's how I've ended up being Assistant Chief Nurse Officer for 2 very large organizations in the US, one for-profit, Tenet Healthcare, and today Sutter Health, a not-for-profit system. I love nursing leadership, and one of the best tools I have in my toolkit is my Rolodex or my network. And if ever you need a tool to be a nominating committee, it is a big Rolodex and a way to call people up that you don't know and explain to them why they're valuable to step forward to participate in an organization like AAACN. You know, look, we've all got other things we can do with our free time, but we're all professionals in nursing. It's a calling. There's a reason we show up for work every day, and for the things we contribute that are not on the clock. And this is one of those things. For AAACN to have a bright future, which I think it does, we need a stellar nominating committee that's got that Rolodex of people in their world who could contribute to our future, to the strategic plan, to the many task force, and the great work product that this organization provides to a big body of nursing that, for me, is probably going to carry the U.S. healthcare industry going forward. So at AACN, I've been a member for 3 years. I've spent a lot of my nursing career with the American Organization for Nurse Leaders and for critical care nurses when I was a bedside practicing nurse. But I have to tell you, in the last decade that I intend to work, which is right now, I'm paying it back to the profession. And I went back and looked at my resume and looked back on my time in ambulatory nursing, and I want to give back. Now's the time for us who are tenured to give back. And this is one opportunity that I can give my time, my executive leadership experience, and my Rolodex to look for great members of AAACN to step up forward. And also importantly, recruit new members to the organization, to grow this organization's body and to grow its talent and expertise. So shortly after joining AAACN, I took on the chair role for RN ROI Value Task Force. We're working on a toolkit that a novice ambulatory leader could use to define and then measure the value of the registered nurse's position in ambulatory practice. We hope to have that out to the membership in the first quarter of next year. So I love networking. I love finding young talent. I love finding young talent and coaching them up and into roles that will grow their career, grow their connection with this organization, and ultimately give a benefit back to all of our members. I think this is a total recruitment position. As I said earlier, recruiting new talent and bringing talent up into higher levels of the organization. And in my last decade, I am committed to increasing the diversity, equity, inclusion of members in new roles and into enriching their careers. We're going to have to change our composition within nursing to match the communities we serve. And I believe we have that opportunity as nominating committee members at AAACN to really look down and wide for those diversity and equity candidates that can really make a significant impact to this organization. I'd like to ask for your vote. And I can tell you from the candidates that came before me, there's some pretty stiff competition in this group. But I want to wish all of my other colleagues who are candidates for nominating committee the very best. Thank you, Jessie.
Thank you, Aaacn. So if you could talk to us a little bit about how you would develop a leadership pipeline that aligns with your role as a nominating committee member.
So, I think what I've done in both of my executive nurse leadership roles is really realize that you've got to keep 3 or 4 layers of talent underneath you coming along, and you have to create opportunities that they want to be engaged with, not what I think they need, but what they think they need in order to grow to their next step of their career. As a nominating committee member, we have the responsibility to look at opportunities for new programs, new task force, as well as who might serve on those committees, task force, and create toolkits like the one I'm doing for RN ROI Value. I think, again, it goes back to the network and pulling membership up and identifying them as individuals who could serve well. Lisa Duncan mentioned avenues that she would use, and I have to agree with everyone that she gave to us. Who presented at the conference? Who's been turned down before? Who do you know in your world? Who do you know that's not a member of AAACN that could become a member and then add to that? But specifically for ambulatory leadership, if there are not programs available for that growth and development of lower level nursing supervisor, manager, director, chief nurse executive of ambulatory services, there are ways to create those programs so that we're growing that talent and we're pulling those members up into those opportunities. I've done that with American Organization for Nurse Leaders, actually sat on their system CNO task force that created the competencies for that role. And I think a similar type of work could be created in AAA.
Thank you, Anna. So in the remaining 10 minutes that we have, we do have a question in the chat. I think actually a two-part question in the chat. Excuse me. I think maybe the best way to handle that is I will read the question, and then maybe you guys can raise your hand in the chat, and we'll try to do a quick round robin and give everybody an opportunity to speak. So the two-part question, you can see it in here. What potential do you see for AAACN in the future? And how do you see members joining in this vision? So I'm going to ask Jenny and Nick to make sure that I'm seeing hands. I'm going to start with Stephanie. Stephanie?
Okay, thank you. Just a few thoughts that I had off the top of my head regarding this question is I can see kind of three buckets, if you will, of ways that this could, that we could advance the organization and increase our membership. One is I'm very interested in evidence base and really kind of beefing up our research abilities in AAACN, and would like to find ways to recruit academic candidates or academic members who would help us, again, create that evidence base for nursing. So how can we make it an organization that they also aspire to? I think we should continue development of resources that so many people have referred to earlier. They're the lifeblood of the organization and really help nurses advance the organization. And third, I think we need to work very hard to raise the profile of ambulatory care nurses, which will also attract additional nurses into the organization, but really help us advance the goals that we want to advance and have better policies in terms of reimbursement for nurse work that we're doing in ambulatory settings. Thanks.
Thank you, Stephanie. I think we're going to have time for everybody. Lisa, Duncan.
Oh, good. I can unmute and turn on my video. Great. So I mentioned that I am working for an FQHC, and I know there's a lot of others in the organization who work for FQHCs. And one of the things I'd really like to see grow with AAACN is the SIG. And whether I'm elected or not, after the elections are over, I really want to put some time and effort into trying to get a SIG going with FQHCs, federally qualified health centers, federally funded health centers who are not FQHC lookalikes, because I think that's a group of nurses who are really out there operating on their own and could really benefit from the knowledge and interaction with people who are facing some of the same things that they're facing, some of the reimbursement issues that they're facing, some of the isolation issues that they're facing. And so I would like to get that area of the organization growing. I'd really like it if HRSA sponsored our memberships to AAACN as FQHC nurses, and I can just drag all the FQHC nurses along with me.
Thank you, Lisa. I'm going to go in order of folks I saw pop up. Cynthia, you're next.
There you go. Thank you. Sorry about that. So I guess what my vision would be, as I spoke about, that I didn't realize back in 2003 that I could join AAACN without having advanced degrees and certifications and all those kinds of things, because nurses are leaders. And what a better way to be mentored and developed within an expert body like this body. So I would want to expand the knowledge and outreach of AAACN membership to all nurses at all levels, LPNs, LVNs, APNs, RNs, at all degree levels, building those strong, well-equipped leaders for the far into the future. I got to participate on that Perspectives in Ambulatory Care Nursing book. And part of that research that I did was, looking at the nurses in the 1800s, late 1800s, early 1900s that were on horseback, riding in the back mountains, or they were in the inner cities, going places where healthcare was not accessible. It was not inclusory of individuals who were diverse. and the nurses met those diversity needs. They went to where the needs were. So they were caring for this population. They were assessing, diagnosing, treating, and preventing illness. You know, I'm not a feminist, but you know, nurses were primarily females at that time. So around 1910, we didn't have the right to vote. And the medical society at that time looked at what the nurses were doing and kind of reined us in. I often think about now, imagine if at that time, that population of individuals, nurses, had the right to vote. And what would that have meant for the American healthcare system at that time and going forward? I think we're beginning to see that impact of nursing on healthcare currently. AAACN is at the very height of that tidal wave that's now flowing over. And we've really produced some excellent nurses who are able to help to lead this nation at our most darkest hour through this pandemic, through telehealth, through our experiences, and through our leadership. So that is my passion for this organization who's given so much to me. Thank you.
Thank you, Cynthia. Mary?
Yes, thank you so much. And first, just want to thank Lisa for her shout out, and so happy to have another FQHC leader on the call. I think, you know, this makes me think of so many things. And although that question is a two-part question, I feel like the two parts are very evenly linked. Because I think, first of all, we really need to focus on expanding our membership, because a lot of this work actually is happening across the country in so many different places in all different forms. And really what we need is for AAACN to really convene and to pull all of this together so that we can really create that knowledge network to continue to learn from each other, right? And I really appreciated Lisa's comments about the FQHC world, because I do think, although certainly in the FQHC world, we are kind of suffering from a lot of the same challenges that other people are challenged with, in the FQHC world, I mean, we have been required to report in on clinical data metrics since like the beginning of time. You know, so we are constantly measuring things. We have grown up in measurement cultures. You know, we've always had to report in kind of the numbers of our nurses, so many other things. We're required to be accredited by Joint Commission or AAAHC, and you know, required to be a patient-centered medical home, and kind of all the things that I think a lot of organizations are really trying to propel themselves forward in terms of their practice transformation, in terms of revolutionizing their team-based models of care, and just how they utilize particularly all the other members of the care team beyond that provider care team member. But even for the APRNs, you know, within our organization, also making sure that they have an equal place at the table. You know, in my organization, we say provider. You know, certainly we give everybody the respect of you know, doctor or nurse practitioner or PA or whatever. But again, that culture doesn't exist everywhere. And so I really see AAACN as this amazing place where we can facilitate this coming together, this knowledge network, this you know, connection. And I think it was Cynthia who had talked about sort of being a convener, being a coalition builder, because all the things that we need to fix and work on and create tools for, it is happening in little pockets of places all over. We just need to be able to pull it together. And I see AAACN as the leader to do that.
Thank you, Mary. April.
Well, to me, healthcare is at that pivotal point. We're shifting from that inpatient focus to ambulatory care, and leaders are actually starting throughout organizations are starting to see really the true value in ambulatory nursing. And I think the pandemic really heightened that awareness by seeing how ambulatory nurses, through the use of telemedicine, nursing triage, are at the core of keeping the patients out of the hospital and out of the emergency department. Ambulatory nurses definitely influence outcomes and metrics, and members play an important role in shaping how ambulatory nursing can influence this change. Looking at what's working, what's not, and what can we do better next time. This will help influence the quality of ambulatory care and just strengthen the organization. So I think this is just a great opportunity for ambulatory nurses to truly make a difference. Because leaders throughout organizations are really starting to really see that value and that shift from that focus on inpatient nursing more towards that ambulatory environment.
Thank you, April. Chris.
Hi, let me see if I can get off. Anyways, I think one of the potentials that I see is AAACN really leading the charge in the vision of the ambulatory nurse being reimbursed for the services they provide. And I think that particularly with the pandemic, we have a window of opportunity because nursing and the value of nursing really became clear. And just to be brief, I think the potential for ambulatory nursing to be reimbursed really needs to be championed and supported by our organization. And that is a vision that we definitely can fulfill. And I see in terms of the membership, I think our membership need to understand the value that they provide and the care that they give, support that vision and help with speaking with other organizations and within their own organizations about the value of the ambulatory nurse. So it just in very brief, that's what I would say.
Thank you, Chris. Caroline.
Hi, I would like to briefly answer this with my academic hat on, because what I see is my students go into the clinic and they see nurses who are not doing things nearly to the top of their certification or their practice or their competencies. And someone else in this group has spoken to that as well, elevating the level of practice for RNs in ambulatory care. I think that's also what will pull people into the profession and into the new pipeline, is if they can see that. It's very frustrating to me to have our students go, well, I just sat around and watched the nurse answer the phone all day long. No, the nurses can do more than that. That would be my pitch.
Thank you, Caroline. Anna, why don't you bring us home?
I will. So I said earlier that I think AAACN has a bright future, and there were 2 reports released recently that involve nursing that I think we need to take a look at and figure out how we can take our place in it. The first one was Healthy People 2030. If you remember, about 12 years ago, they released the initial Healthy People 2020 report, which was focused on basically health equity and social determinants of health. Well, guess what? We didn't do really well in solving the call to the challenge in the 2020 report. So in August of last year, while we were all still dealing with vaccines, pandemic, and everything else, they released the Healthy People 2030 report, and it is focusing on health equity and social determinants of health. They've lowered the number of things to achieve, and they focused in on the 2 that really are going to make a big difference. The second report that came out recently was the Future of Nursing for 2030. Again, a second report that followed up the first one that really is beginning to focus on nursing's contribution as a professional licensed practice to contribute to the wellness and the health of our communities. When you look at health and healthcare is only 20% of what really makes you healthy. The rest of it, the other 80%, is who you are, where you live, your income, you're insured or not, your education, food insecurities, housing. So those 2 reports, Healthy People 2030 and the Future of Nursing in 2030, have a rich call to action for nurses. And I believe most of it applies to AAACN's strategic plan, particularly about partnering with other organizations so that we can collaborate together and strengthen both of our mission and outcomes. So I think we have a bright future. I think we need to look at those 2 reports and figure out how can we, as a body of professional nurses, seasoned in ambulatory nursing practice, contribute to the success of our nation by 2030. Thank you, Ann.
Thank you, Anna. I just have to say in closing, I am in complete awe of the level of leadership that's gathered here today that has volunteered and put their application forward to be leaders in AAACN. And I thank each and every one of the candidates for applying and for wanting to serve AAACN. Really appreciate that. And what really brings it home for me is I feel like AAACN will be in incredible hands with any one of you in the roles that you've applied for. So thank you very much for your time today. Please remember that voting opens on November 1st. Not only can you guys go in and vote, but tell your friends to vote. We really want to get out the vote. But in closing, thank you so much for attending, and we look forward to seeing you at conference in May in Vegas.